the President's Malaria Initiative. This was an initiative started by the U.S. President to combat malaria all over the world. And Kenya is one of our focus areas. This region of Kenya, around Lake Victoria, is one of our focus areas in Kenya. And your county, Siaya, is one of our focus areas in that.
Very soon, we may do a pilot implementation of the malaria vaccine for children. There we also need your support. That's another arsenal in the fight. I want to thank the American government. They have taken it boldly to invest in the spray.
We have 4 specialized vaccine refrigerators here. And here are the keys for the pickup. Yes. These are
Brand
the keys.
new.
Brand new.
Yes.
There is also a motorbike.
Then you can start it. Yeah.
This year, the World Malaria Day is quite special in that we are not just celebrating the day, but also we are launching a strategy that will guide our investment in malaria. And mark the words, our investment, all of us, national government, county government, partners, everyone. Our investment in malaria for the next 5 years, from 2019 to 2023. And malaria is a problem in the world. It's really a big problem. Over 125 million people get malaria infections every year. Unfortunately, 400,000 plus die every year due to malaria. And unfortunately, 90% of the problem occurs in sub-Saharan Africa. But we have managed to fight malaria. And for us to sustain those gains, we need to have a strategy in place. We want to direct and coordinate efforts towards a malaria-free Kenya through effective partnerships.
RB, as a company focused on healthier lives for people, believes that it's our part and our mandate to be actively involved in promoting the achievement of health-related goals in Kenya. We remain committed towards this through educational initiatives as well as product solutions that are geared towards the prevention of illness. Our strategic collaboration with the Ministry of Health over the past 10 years and implementation of initiatives around World Malaria Day is a demonstration of our commitment, which we will continue. We're also very pleased to be part of this occasion here in Siaya County that seeks to build on effective partnerships geared towards raising awareness on the national malaria control efforts and in line with the new strategy's mission of continuing with effective partnerships. And for us at a local community level, we believe on being very focused and targeted, and will continue playing this integral role to equip the right communities with the right education on how to beat malaria.
I'm overjoyed to be with you here on World Malaria Day, because the fight is here, because I can see everyone here who is fighting with us in the US government against malaria. The implementation of this strategy will guide our efforts together over the next 5 years. And we made sure, working with our partners, that this malaria strategy contains targeted, smart, evidence-based investments. So together, we can have the greatest impact on the people who need it most. Through the President's Malaria Initiative, we are investing 3.5 billion Kenyan shillings on the fight against malaria. The American people believe in this. And that's why we are investing in the people of Kenya. And I can tell you, it's working. We've already heard that the malaria endemic map here in Kenya is shrinking. From 2010 to 2015, national malaria prevalence dropped from 11% to 8% across the nation, with an even greater reduction in endemic lake areas like here in Siaya County. As a middle-income country, it's important that Kenya's health strategy is ultimately self-sustaining. Together, we can create a future where no Kenyan has to die or suffer because of malaria.
And as we know, children under 5 and pregnant women are particularly affected, especially when referring to the number of deaths. In Kenya alone, as we know, malaria remains a disease of significant public health burden and significant public health concern, with 70% of the population of this wonderful country who are at risk. And we know that malaria accounts for 15% of all outpatient department attendance in the health facilities, and countless cases, of course, in the community as well. I am privileged to be here today on behalf of UNICEF, WHO, and the rest of the UN families in order to celebrate the collaboration with the Ministry of Health, with the counties, in the successful implementation of different malaria eradication and malaria prevention, diagnosis and treatment interventions, including the previous malaria strategy, the malaria program review of that strategy, and then the development and today the launching of the new malaria strategy. I'm happy to note that the new malaria strategy is very well aligned with the global priorities and with the 2015 call of the World Health Assembly to scale up malaria responses and move forward towards elimination. And it has endorsed the very bold vision of malaria-free Kenya, which is commendable.
What has been really lacking and where the gaps have been is that the government has done a lot in the past, but information is not reaching the rural person. So this is where this strategy needs to focus on, to target the rural person, take information to them so that they are able to prevent themselves from attacks from malaria. Because of lack of information, our people outside there have been going to the traditional herbalists. And some of these herbalists have fake drugs that they are not effective in the management of malaria. So if they are given information, they will shun going to these traditional herbalists and they will seek proper medical attention. Another challenge has been testing.
I'm so excited in the manner in which the program head actually presented the strategy, and I am looking forward to the same implementation of that strategy with the energy that you're having, Daktari. Thank you so much. Statistics don't lie. The reduction is 11%. Right now, we are all excited about Kenya free of malaria. That means the remaining 27 has to be accomplished within the ambitious strategy, unless I got it wrong. What I was calculating, I realized that all of us have to double, more than double what you did in the last to be able to reduce malaria by 11%. Meaning, for our head of mission Kenya, Thank you so much for the 3.5 billion. We'll be looking forward to 7 billion. Can you clap for him? Because that is really what it means. And therefore, I want to challenge all our development partners, all the implementing partners, that the efforts you made for us to come down with 11%, you are going to more than double it so that we can be able to actually realize our dream. I can see others laughing, but that is the reality. Because when we were talking, everybody's excited, yes. And more so, we even have actually the ambition of eliminating malaria.
Today, as we commemorate World Malaria Day, I can report that we have applied ourselves in addressing the causes of these poor indicators by, number one, investment in primary health care services, with Siaya becoming the first county not only to have 100% coverage of community health volunteers, but also the first county to pay them a monthly stipend of Kenya shillings 3,000. They have also become champions in the fight against malaria by testing for malaria at household level and offering treatment for the sick through community case management. Construction and opening of 32 new health facilities countywide to improve access to malaria screening and treatment services, essentially bring these critical services closer to the people. We have invested extensively in human resource for health by employing 442 health workers. To join the number we inherited after devolution, capacity building of the health worker in new and innovative ways of handling health challenges has been a priority too, and we appreciate the strong support received to this end from Malaria Control Program and our partners, most of whom are here today.
Ladies and gentlemen, malaria remains a disease of public health concern in Kenya, with over 70% of the population at risk of infection. The most vulnerable are children less than 5 years and expectant mothers. Nationally, malaria prevalence stands at 8%, with Nyanza region having the highest levels at 27%. The coast, a previously highly endemic area, its prevalence has fallen down to 8%, and all other areas within the country at a prevalence rate of 5%. A quick calculation of this objective will tell you that we need to reduce in Siaya, where we are today, the prevalence rate from 27% to about 6 to 7% in the next 5 years. I think it is a huge task, but I think the systems and support are in place to achieve this goal. Ladies and gentlemen, malaria prevention will continue to be a key pillar of our strategy. The distribution of long-lasting insecticide-treated nets to communities and indoor residual spraying in high-burden counties has yielded great results in reducing incidence of malaria. Currently, over 90% of our public health facilities have the capacity for malaria testing and treatment. We have now unveiled the two documents, the Kenya Malaria Strategy 2019-2023 and the Monitoring and Evaluation Plan 2019-2023.
I want to appreciate the fact that the Siaya County is actually leading from the front, and it is one thing that we request that other governments, the county governments, because it has started from that low level of community, and really congratulate all the community health volunteers who are there. Are you there? Thank you so much, because if you are not there, then the top cannot succeed. We must start from the low. And I want to believe that one day we'll come back to Siaya to actually benchmark how far they've gone, because they have started in the right direction.
No child should have to die from malaria. No mother should be sick because of malaria. No father should fail to go to work to provide for his family because of malaria. And that's why we're here.
There are still significant gaps which are still remaining in order to ensure the effective coverage of long-lasting insecticide nets, indoor residual spraying, preventive treatment during pregnancy, prompt quality diagnostic testing, and effective treatment to all confirmed cases with effective anti-malarial medicines. And finally, and most importantly, the effective engagement of households and communities through the network of community health volunteers and community health units.
And we also know that our county does not have sufficient resources to help in enumerating our team that is working in the community. I want to say this because I know donors are focusing more on preventive health, how to pay, how to bring drugs, how to pay doctors. But you don't focus on how to pay these people who work for us. So, since everybody is saying that this model is working and it's good, and if you ask me, I think this is the preventive approach to medicine. Because if we have people who live in our community, they are able to even see when somebody is sick before they get to the doctors. So actually, nyinyi ndio daktari. You are the daktari original. So I want to ask the donors, next time, please give us some money as a county that we will be used to pay Nyamreroas.
Ladies and gentlemen, prompt diagnosis and effective treatment is a cornerstone of malaria control. The country's strategy is to test all suspected malaria cases and treat all malaria-positive cases with the recommended medicine. Malaria diagnosis and treatment is provided free of charge in all public health facilities countrywide.
I have to thank the national government for settling on Siaya to celebrate this important event in Siaya.
To prevent mosquito bites.
Is it treated with the first grade?
Yeah, it's treated.